These are the three gross or commonly used types of ECMOs. The VA ECMO, that is a veno-arterial ECMO. VV ECMO, that is a veno-venous ECMO. VAV ECMO, that is a veno-arterio-venous ECMO. So when you see any nomenclature of the ECMO, it always has at least two names. Like here you have a VA, here you have VV, here you have more than two, that is VAV. So the first part of that nomenclature, whatever it is, indicates the area from which we are draining the blood. V always stands for venous, A always stands for arterial. So here the first part is V, that means you are draining from the venous side of the circulation. The second part indicates where are we returning this blood to. Here it is A, that means you are returning to the arterial side. Here it is VV, so you are draining from the venous and you are returning back to the venous side of the circulation. Here it is a hybrid type. So these are the three types, and this is how they are labeled, or how do we understand the nomenclature. So let us look at the first type of ECMO, that is a veno-arterial ECMO. So what happens here? We drain the blood from the venous side of the circulation, and once you pass it through the pump and oxygenator, you return back that blood, post-oxygenator blood, to the arterial side of the circulation. So this goes with a good pressure, the pressure as good as our normal mean arterial pressure, to the arterial side of the circulation. So what are we doing here? We are bypassing both the heart and lungs. You are draining from the venous side, somewhere from the right atrium or the major vessels, and you are passing it through the ECMO circuit, and you are returning to the arterial side. So in this process, you are oxygenating, you are pumping the blood. Along with that, this blood is totally bypassing the heart and lungs. So this ECMO circuit in a VA configuration does work as both heart and lung. It supports both the heart and lung function. It takes care of both the circulation and it takes care of the gas exchange also in these patients. So this is a schematic diagram. As you see here, the venous cannula is placed through the femoral vein, iliac vein, somewhere in the right atrium there. As you see here, the dark deoxygenated blood is getting drained. This is an ECMO console, all-in-one integrated console. It has both the oxygenator and the pump there. Once it is oxygenated, the bright blood you see is getting returned back to the patient, and this returned blood is coming back to the arterial side of the circulation. As you see here, this is through the femoral artery. You are giving it somewhere in the external iliac artery or common iliac artery there. So this comes a VA ECMO. So you are bypassing both the heart and lung in a VA ECMO. The next type is, this is a video which shows a patient on a VA ECMO. If you see here, so one cannula is the venous cannula, the other one is the arterial cannula. So you are draining from the venous side, that is the oxygenator, this is the pump. So the blood comes to the pump, from there goes to the oxygenator and returns